Thank you for joining me today. I am with Annette Green, and she is an SVT patient who is living fabulously. And she has been willing to speak to us today and share a little bit of her journey. So I'm just going to turn it over to her for a nice introduction. Annette?
Okay, well, thank you for inviting me. In terms of an SVT journey, I think back to I guess it was approximately 20 years ago when I was first diagnosed with SVT. And like a lot of people, I didn't know what it was. But so I was just around 50, and now I've just turned 70 and I've just retired from a career in education. I worked in a community college with English as a second language students for a long time I was living in Washington, D.C. and worked in Maryland, and retired here to Florida. But yeah, it's been quite a journey, and I'm very happy to talk to you and have my story get out in hopes that it can be helpful to others, because one thing I have learned is that this is not a rare condition. There are a lot of people out there, maybe a number of people who are undiagnosed, but there are a lot of people out there with SVT.
Great. So take me back to when you were diagnosed. What types of symptoms did you have that caused you to see a doctor?
I had this, as in episodes of a rapid heartbeat for probably, let's say, 4 or 5 years before I was diagnosed. I remember the first time it happened, it lasted about a minute. And I just thought, wow, it was obvious to me that when it started, my heart was not beating at a normal rate. It was beating very fast, but it just converted on its own and stopped. And when I would ask doctors, whether it was a primary care doctor, or I guess I saw a gynecologist at that time, they'd say, well, with your age and menopause coming on, this kind of thing, the tachycardia is kind of normal, don't worry about it. So I guess, I didn't even record the episodes or write anything down. And then if they got a little bit more frequent over the years or lasted a little bit longer, I thought, this is something I have to keep asking doctors about, until finally one primary care doctor said, well, you should go see a cardiologist. I have to say that I could still remember back then, I was kind of horrified. Oh no, seeing a cardiologist and, a specialist, that sounds too serious, but I did. And I'm trying to remember if I got a monitor. At that time, there were no monitors that we could buy like there are today, like the Cardia monitor. I don't know if the cardiologist gave it to me or she just referred me right away to an electrophysiologist, but somehow I got a recording on a monitor, and it was pretty easy once the rhythm had been captured, that doctors, their cardiologists, primary care or electrophysiologists, to see that I was a classic case of that arrhythmia, which they call SVT. I remember being a little horrified then. I mean, it's hard. I do remember thinking, oh, I actually have this thing. It doesn't sound good. And I didn't know anybody else that had anything like it. So that was even kind of worse to, what is going on? And yeah, what am I going to do about it? But that was the beginning of, it was, yeah, so it was a number of years at the beginning, the whole process, just to even identify that.
Yeah, and I think it's so important to raise awareness of disorders like SVT, so that people are aware that there is a name to what they're experiencing and that they can find help. And so that way they're equipped with the information when they go to see specialists and doctors, and not get just brushed aside, thinking it's something like, oh, well, you're getting older, or, oh, you're going through menopause, things like that. So I think it's really important for people to understand that bringing awareness to the disorder is so vitally important.
I think I've heard that a lot of people, this SVT tends to be something more common in women than men, but I have heard of a lot of women, if it wasn't being brushed off because they were getting close to menopause, they were just told they were anxious and just to calm down, relax, and this won't, you shouldn't worry about this, when it really is something that, sure, it can be triggered by an anxiety or a rush of adrenaline, but you can be in a perfectly relaxed state and have an episode. So yeah, it's probably, I would say, even today, if you mention different arrhythmias, probably still like something like atrial fibrillation is more common, people that don't know much about arrhythmias, whereas SVT is not understood by the average person. And maybe the word tachycardia might be by itself understood. Yeah.
Yeah. Yeah. So when you are your episodes under control now? First.
Are they under control? I have been on meds for a long time. And I'm very aware. I take this beta blocker every morning, and it doesn't control them 100%. I was thinking back to when because I stopped writing them down, but I was thinking maybe like 6 weeks ago is the last time I had an episode, and it didn't last that long. A couple of things, because when we've lived with this for, well, I'm going on really 20 years, one knows that you don't just sit back and wait for it to stop. So I use some physical maneuvers to luckily, I feel very fortunate that these days, maybe a few minutes, 5 or 10 minutes, and I can convert an episode, even though my heart is racing at I run about 180 beats per minute. But backtracking a little bit, because this is so common now with people with SVT, there is a procedure called an ablation, and I was offered it, and I guess that took place in 2011. So again, about 5 years after I was diagnosed. So 10 years into the journey, I did have a cardiac ablation performed by an electrophysiologist. I think there were 2 present. And it really did take me 5 years to think about it and agree to do it. Yeah. I don't know if you want me to go on with that part of the story, because it's a common procedure. A lot of people, as soon as they get diagnosed these days, will be offered an ablation. I think it's very common here in the United States, and they're told by electrophysiologists that the cure rate is very, very high. And some people just do it right away. I've heard of people who just will get diagnosed, go ahead and have the ablation, and say, well, that's better than being on medication. My ablation was pretty straightforward. They found 2 pathways and they ablated them. And I remember waking up from the procedure and they said it was successful. And I was just absolutely thrilled. It was, and I didn't have a difficult recovery. But what I have learned since, and this was, just a real reality check, is I started having episodes again within the first couple of weeks. And doctors do tell you there's a healing period, that one could expect these things to happen. My doctor didn't tell me too much. I also didn't get a monitor to record what was going on for approximately 9 months. If I had the ablation, which they called successful, in February, it took me until November to convince electrophysiologists that, there was something happening there, and they needed to take a look at it. And I'll never forget then recording the episode and going in and talking to the doctor, and her comment was, well, unfortunately, the SVT returned. And my question was, you said it was successful. What happened? And then I learned, and I believe this is very true even today, and maybe not just for a procedure like an ablation. The success is considered, the procedure is considered to be a success at the end of the procedure, when you are wheeled out of that cath lab and they cannot induce SVT anymore. And then there's healing and scar tissue and whatever. And what happens after that, then, all kinds of things can happen. So, because mine went so smoothly, all I can say is answers I got from my electrophysiologist, and then second opinions that I got, they simply said that, sometimes the heart electrical system will find new pathways to activate and SVT returns, or the pathways that were ablated. We're talking millimeters here of tissue that actually they ablated or destroyed the pathway, but they actually reconnect. And there's your SVT again. So,
So it's definitely not 100%.
No, it's not 100% cure, but even this, because I've talked to a number of electrophysiologists, and when they're quoting, 95%, you just think, well, how could I possibly be in that small group where this didn't work? But I've since I got diagnosed and didn't know anybody with SVT, I have to say that I have heard a lot of stories like mine, because I'm part of a Facebook group, and we have 20,000 members. Now, not all of those people have SVT, but we have a lot of people on there who share their stories and, come on a group and ask questions and compare things. And I have to say that with all of the people's stories we have with ablations, that having the arrhythmia come back, whether it's a short time later, like happened to me, or months, or a year later, or a few years later, I have really come to the conclusion that it's hard to call it a cure in my eyes, because I do believe that even if I meet somebody who had an ablation 10 years ago, let's say they're middle age, I don't think any doctor can guarantee that SVT will not recur at some point in their life. I really do not believe that. I just feel it's a little misleading to tell people there is a cure, because some people are devastated. They really, really are. Mine kind of happened gradually. I kind of knew from the beginning, and was just confirmed, but I don't know. And some people have worse symptoms than I have when they have an episode. So it can be really hard. And there's the the financial cost of it,
Yeah,
depending on insurance, and there's a lot of factors here. Yeah.
yeah, for sure. So, what advice would you give to somebody who is experiencing episodes of rapid heart rate? What advice would you give them if they were looking for treatment or looking for a doctor from a patient who's been there?
Well, I know I've seen a couple of cardiologists, and first the one I saw at the beginning, and then later in my journey, just to get questions answered. And I can tell you that cardiologists really don't want to deal with people with SVT. All they do is refer us to electrophysiologists. They say, like they're the plumbers and the electrophysiologists are the electricians. But maybe you can't get in to see an electrophysiologist without being referred by a cardiologist. Um, Secondly, it is a tricky thing to diagnose, and you can sit there and have taken notes and recorded things and recorded your heart rate, and pulse oxes are really common things that people have to record the oxygen levels, and they can say, well, my heart was beating at 200 beats a minute. And that doesn't tell the doctor enough. You need to have them have a recording of the rhythm. So the few ways that I've learned, of course, back in, this is more than 10 years ago, I was given a monitor for a period of time by a doctor, I think maybe for 2 weeks. And I was able to I had an episode during that period and caught it. I don't know, the one that I really like, because I think that you have so much more control over it. There's a little device called a Cardia with a K that costs about $100 on Amazon, and there's a newer version now that is even more sensitive. And if you can catch some episodes, and it's, even if you didn't have a doctor at the time, all you have to do with that recording of that episode is email it to yourself, save it in a file, and then when you do have a doctor, when your doctor's appointment comes up, you show them the recording of the rhythm. I personally can't read an EKG, and I've never attempted to, but the ones that I have, that I've shown various doctors, it's pretty clear that that's what I have. And I've learned, and that's what I advise people, it really isn't the beats. You could have 150, it could be 250. It's not really going to impress the doctor or allow them to make a diagnosis. It's what they see, and that arrhythmia, the word arrhythmia, as you know, means an irregular rhythm.
Right.
Yeah.
So I think the important piece of that is that we need to be our own best advocates as patients and go and not just tell, but really have some documented information to give to our healthcare providers, because unless they can see and understand what's happening, it's probably takes a lot longer to really diagnose and to help you as a patient. And definitely a 48-hour Holter monitor isn't going to maybe show anything. It's got to be long term. So it's really important to advocate for yourself in those positions.
But I think the other advice I've gotten from doctors, which I found was not as useful as things I learned from other SVT patients, is the fact that there, and I think it depends on the person. I'm lucky I can walk and talk and function even if my heart's beating 180 beats per minute. Some people have worse symptoms and really have a hard time and might need to call an ambulance. But they say, some doctors will tell you, well, if it's been 20 minutes, if it's been 30 minutes, I don't know. I had one doctor say if it's been an hour, just go to the ER. And they don't teach you much about trying to convert an episode. And I guess in the 20 years, I could say that I have been to an ER twice to get converted, because I've learned that my episodes, number one, will not stop on their own in a minute or two like they did back in the beginning of my time with SVT. But I can do things. I can do maneuvers, and I've done a lot of yoga over the years, and some of the maneuvers, like laying on the floor with your legs up against the wall, and then knowing what to add to that, they really do work, and I feel very grateful that they do work. But although some doctors will mention and teach some things, I don't know what it is. There may be some reasons why they don't want to, maybe just to cover themselves. The best thing is to get medical attention.
Yeah,
but
sure.
I don't know. An ER visit is something that I really try to avoid. And, I was grateful for the times when I couldn't stop it. And I did get help, but it's so much preferable if I can do a maneuver,
Right,
and stop it myself.
right.
Yeah.
Well, and I think we've learned a valuable lesson of support, right? And connecting with others who are in the same situation as you are, because you really can learn a lot from other people, and not medically, not medical advice or medical information, but really how to just live with what you're dealing with, and tips and tricks, right? And I think that that's so important, and it's something that all patients should really focus on, is having that community of support with patients like them.
And I think that one thing that I probably knew instinctively early on, but it was hard to put into practice, is just the fact that when you do go into an episode, probably one of the worst things you can do is panic, because that gets the adrenaline flowing.
Right.
And,
Yeah.
you're not going to convert it, because you're really just, in a sense, fueling that
Right.
episode.
But then you're also very panicky because something is happening. And so I can understand that. And so, yeah, learning to understand how to calm the mind and calm the body. Yeah, I think that those things are really important. So,
Yeah.
well, in the minutes that we have left, is there anything that you'd like to share that you think is really important, being that it's going to be SVT Awareness Day and we want to raise awareness about SVT? What would you share as your final thoughts?
I think that people have been diagnosed with SVT, or even they suspect that they have SVT. Please be aware that you're not alone. This is actually something that's very, very common. And I still believe there's probably a lot of people out there who are undiagnosed. And, don't be afraid to keep asking questions of your doctors and share things, and try and get help. But I personally don't use Facebook very much, except for our group, but we have a group, which, if you search in Facebook groups for SVT, our group will pop up. And I just believe that the support of others who have had SVT, even if some of them will have ablations, yet they'll still stay in the group to share their stories. But I just think it's really, really important not to live with it by yourself, and also to share it with your families. I think that it's not something to be embarrassed about. Sometimes family members will have it as well. It's not hereditary and doesn't necessarily run in families, but I think that it's also important to recognize that, even like myself, my heart rate can be 180 beats per minute, but it's something that you can't ignore. There are a few people in our group that said that, well, I went to sleep, or it was like this for 24 hours. And even if it's not the kind of thing that is really dangerous, especially if you're a younger, healthier person, it can wear your heart down. It can be hard on. Yeah. So I don't know. I hope those little bits of advice.
Yeah, I think that's great. Be your own best advocate and surround yourself with a support group of your community of others, and know you're not alone. I think those are fantastic messages. So thank you, Annette, for sharing with us today your journey. And I'm so glad you're doing well.
Okay, well, thank you. It was very nice meeting you, Andrea. Thank you.